Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through August 25th, 2022. This week, I want to talk about a really important public health issue that we haven't talked that much about, and that is cancer. What percent of cancers are potentially preventable? And then I also want to do a quick update on monkeypox because it remains in the news. So what percent of cancers are potentially preventable? So a report came out a little less than a week ago in The Lancet, the British Medical Journal, and it looked at all of the known risk factors for cancer globally. And they said their goal was to understand the magnitude of cancer burden attributable to potentially modifiable risk factors for the development of effective prevention and mitigation strategies. That's great. What they're really saying is what percent of behaviors of cancers are due to preventable, changeable behavior. So let me back up a little bit and make sure we all understand what we're talking about. Cancer, of course, is not a single disease. It's over 100 different diseases. You'll sometimes hear it described by its location, lung cancer, liver cancer, or by the types of cells involved, epithelial cells, squamous cell cancers, and so on. The centers are the National Cancer Institute, in their publicly available material, describes cancer as a disease in which some parts of the body's cells grow uncontrollably and spread to other parts of the body. Really, the way to think about cancer is that cancer cells differ from normal cells in a number of ways. They don't all differ in all of these ways, but they differ in the sense that they can grow without a signal telling them to grow. They will keep growing even if there's a signal to stop growing or to die. They invade into new areas. Most normal cells don't do that. They sometimes cause blood vessels to grow towards them. They hide from the immune system. They can trick the immune system into helping them grow and stay alive, and they can handle nutrients differently. So the way to think about cancer is 100 different diseases that are characterized by abnormal growth of cells. It's a very, very important disease, of course. Taken together, all cancers are the second leading cause of death, both worldwide and in the United States. And if you look at these numbers, it's pretty dramatic. Heart disease is the leading cause of death in the world, followed by cancer. And then the numbers drop off pretty dramatically. So roughly 10 million deaths a year from cancer. And it's also the second leading cause of death in the United States. In terms of where these abnormal cells are, overwhelmingly what we would call lung cancer, tracheobronchus and lung cancer, followed by colon and rectum, stomach, breast cancer. These are the ones that cause death. Pancreatic cancer, esophageal cancer. You know, we talk a lot about leukemia and lymphoma, but it's important to recognize that these other cancers are actually larger causes of death. If you're interested in a particular type of cancer, you may want to pause the video at this point. Of course, not surprisingly, cancer deaths occur in older folks. Again, we typically don't think about that, but that's the case. So this article asks the question, okay, of all the cancers, can we calculate how many are preventable due to our behaviors or factors like that? And they concluded that 44%, close to 50% of all cancers, think about that, the second leading cause of death in the world, and almost half of them are preventable. Over half of the cancers for men and over a third of cancers for women. When you look at the standardized death rate for the contributing factors, you will see something pretty remarkable, which is smoking, tobacco use, overwhelmingly the largest one, followed by alcohol, some factors related to diabetes, obesity, occupational exposures, and then a lot of factors related to diet. If you look at this is sort of the attributable risks for all cancers. You see this huge number. This tells you what type of cancer they are. And then you can see that tobacco use is a major contributor, especially to lung and tracheal and bronchial cancers. And then the list goes on down. Women are a little bit different than men in terms of their cancer risk. Smoking is still the leading contributor, but less dramatic than it is with men, followed by unsafe sex as it leads to cervical cancer. And so you can see again, the total number is smaller, the contribution of tobacco is smaller, and then unsafe sex as it leads to cervical cancer. And if you compare men and women, and you can see this dramatic difference, many more, 50% of cancers in men are potentially preventable, over a third in women, and men, tobacco play a larger role. Now, that's not to say that women are somehow immune to cancer, to tobacco-related cancers. It's just culturally around the world, less women smoke, fewer cigarettes, if you will. So 44%, almost 4 in 10, almost half of all cancers could be prevented, half in men, over a third in women. Here we are talking about the second leading cause of death globally and in our country. And after all these years, 60 plus years since the Surgeon General's report on smoking came out, we still have this overwhelming burden caused by nicotine addiction and tobacco use in our country and around the world. So pretty important for folks to know, because obviously if we can prevent cancers, we really need to do that. And I would encourage policymakers and others to look at this list and start determining which factors we might be able to impact. The second issue I want to talk about today is just the latest on monkeypox. And if you're interested in a review of what monkeypox is, I believe it was our June 14th weekly update that we went into monkeypox in some detail. So far, 45,000 cases in 98 countries around the world. Overwhelmingly, these are in countries that have not historically had endemic monkeypox. You'll recall that monkeypox has been known since the 1970s, particularly as a disease in Western and Central Africa, the countries shown in blue. All these others are in what we would call non-endemic countries. And if you look at the number of cases in each country, the United States leads the pack by a wide margin. Fortunately, as uncomfortable and painful as monkeypox can be, it has a relatively low death rate. I believe that it says 12 deaths that have been reported, of which 7 are in endemic countries and only 5 are in non-endemic countries. In the US, there have been 16,000 cases now in all 50 states, and we've had no deaths reported. These kind of maps don't tell you very much. They just tell you the number of cases. But since you know that California, New York, Texas, Florida are among our most populous states, it doesn't really tell you very much. But if you're interested, here are those states that have had more than 100 cases. If you go to the CDC link there, you can find your state if it's not shown here. Now, the last couple of weeks, we've shown this chart of the weekly number of cases, and I suggested it looked like we had peaked and might be coming down. But what's happening is we get this very sporadic, inconsistent reporting, where there's some days of the week where there's a lot of reports, and some days, presumably the weekends, when there are fewer. So I went back and created a weekly total of number of reported cases by week, starting on July 3rd. And what you can see is it has been rising, and it may now be cresting or coming down. Now, be a little bit cautious, because of the way diseases are reported, there may be a lag. So I haven't shown the last 4 days anyway. But again, we'll have to just keep our eye on it. And this is consistent with what we're seeing from Pan American Health Organization. It's really, you can really see it quite clearly. They've combined all the countries in the Americas, and you can see starting in June, there was this increase to about mid-July, and then it's been coming down pretty rapidly, except for the United States, and possibly it looks like Peru is also quite high. So what percent of cancers are preventable? 44%, almost half. What's the latest on monkeypox? 16,000 cases in the US. And again, a global outbreak in countries that have not historically had it. Definitely something we want to keep an eye on, just as we want to keep an eye on COVID, and I'll come back to that in a future week. By the way, it was the June 16th weekly update that I go into some detail on what monkeypox is. If you'd like to see that, it shows pictures of the rash and talks about how it's spread and how we can control it. Please feel free to share these videos with anyone who might be interested. Obviously, this is a free service, but we want folks to get as much accurate information as they can. If you know anyone who'd like to be added to our listserv, please contact Jan Stork. We don't send out bills or anything else. We just send out information that we think is accurate and important. Thanks as always to Dara Young for editing, producing, posting, adding captions, and otherwise handling these videos. And as always, if you have any questions, comments, concerns, disagreements, arguments with anything that I've said, please feel free to let me know. I look forward to hearing from you. And that was my friend, potential spam, calling me again. Thank you for watching. And until next week, please be well.